Hello. Again, I'm Dr. Minacchio, Medical Director of LUXUS Med Spa. A very important part of medical practice nowadays is hormone replacement. Bioidentical hormone replacement is a way to actually anti-age a person, prevent the diseases of aging, those namely hypertension, diabetes, cardiovascular problems, dementia. All of these processes are propagated, they progress a lot faster as our hormones go down. And all of us have very low hormones nowadays. Actually, it's thought that our hormones are 30 to 40% lower than our parents were one generation ago. And it's because of our lifestyle, inflammatory lifestyle that we kind of all are stuck with. Computers, cell phones, these microwaves are damaging membranes, causing our own immunity to kind of degenerate our own bodies. And the result is very low vitamins, very poor cellular function, more rapid aging, and certainly progression of the diseases of aging, cardiovascular disease, etc. Bioidentical hormone replacement is actually putting back the hormones that we have lost with this aging and this inflammatory process. And we use the exact same molecular structure molecule to replace what your ovaries normally make or your testicles normally make. It's kind of thought nowadays that men come in for testosterone, women come in for estrogen, but testosterone is very important in a woman's body. Estrogen is also important in a man's body. But they're very important in each of us, and there are more testosterone receptors on a woman's heart or on her brain than there are on a man's testicles. So, it's a very important hormone for keeping us young and healthy, and our hormones are the highest when we're 25 years old, and that's when you have the lowest incidence of cancer and strokes and heart attacks, and you're really the healthiest. Common for a woman to go to her gynecologist and or her medical doctor and have her hormones measured, and then the doctor comes back and says, well, your estrogen is 0, but that's normal. And yes, it's normal, but it's very bad for you. It's not very healthy. You're losing 10 to 15% of your bone every couple years. Your heart's getting weaker, your brain's getting weaker, and it's very simple for us to replace with bioidentical hormones and prevent some of those things, completely prevent osteoporosis. The FDA, doesn't want us to get healthy, probably is never going to approve bioidentical hormones, but they want you to keep buying their drugs. The drug companies want you to take their Boniva, and all that's going to do is slow down the bone loss and make you lose 12% of your bone instead of 15% of your bone. Whereas replacing your estrogen or replacing your testosterone is going to absolutely prevent it and regrow bone. We have to prevent things like falling and breaking our hip when we're 70 years old. That's the leading cause of death. And it's all because our bones are weak, our gait is unstable, all of the things that hormone replacement can prevent. With hormone replacement, there are various techniques used or modes of administration. We can give you a cream that you put on your skin after a shower, or we can give you a pill to take either in the morning or at night. Injections are very popular for testosterone replacement, and certainly nowadays we can use very, very tiny needles that you basically don't really feel to replace that testosterone. But a real exciting new development it's not so new, but a real exciting development in hormone replacement is a pellet therapy, where we take a little pellet, which is about the size of a grain of rice or a little bigger, and we put that in your hip under the skin into the fat. And this slowly releases hormone over 6 months, and it can accomplish a very steady state, a very even level of hormone administration, which is kind of what we want in the human body. For example, testosterone is put out every 7 minutes or so, so we do kind of get a steady level all day long. And with the pellet therapy, we can achieve that, as well as it's actually kind of physiologic, because if we increase our activity, increase the circulation, then a little bit more of the testosterone or estrogen can get released, similar to what your body does when it's stimulated from more activity. One of the benefits of the pellet therapy that both men and women do enjoy is that it's very convenient for them. They come in once every 4 to 6 months, have a 5-minute procedure, and they don't have to deal with the administration anymore. Again, the pellet is slowly released, estrogen, testosterone, DHEA if necessary, slowly, gradually over 4 to 6 months. You don't have to put a cream on each morning or have an injection once a week. One of the benefits that you'll enjoy from one of those medications, progesterone in women especially, is it's a great way to help you with your sleep, calm you down, prevent all those PMS and postmenopausal problems that a lot of women have to deal with. Again, though, the pellets are very nice as far as convenience.